Good afternoon, I'm Dr. Deuk. Welcome to the live stream of spine surgery at Deuk Spine Institute. Our patient travels here from
Palm Beach, Florida.
all the way from Palm Beach, Florida. And he suffers with neck pain. He has two problems. He has facet joint pain in the back of his neck, and he has discogenic pain. We're going to fix both problems today. We're going to start with his facet joint, and you're watching the Deuk plasma rhizotomy, a procedure where we actually go in and deaden, we call it rhizotomize, the pain nerves to his arthritic facet joints. It is actually inflammation within the facet joints that causes all the pain. As a matter of fact, take a look at the very first joint, right below the needle. Can you show us the needle tip, Jordan? Henry, can you see the needle tip?
Yes, we can.
Look at the joint below it. A little bit up. There. A little higher. Look at the sclerosis of the facet. See how dark it is, that one and the one above? There it is. So it's dark because, well, the bones have been rubbing on each other for a long time with arthritis, and that causes a thickening of the bones, known as sclerosis. Hold on. Shot. So I'm right over that arthritic joint. First thing I want to do is put some numbing medicine to make it more comfortable for our patient. He is asleep. I want to give him a little bit of numbing medicine in there so that he can be more comfortable during the procedure. Then we're going to perform our Deuk plasma rhizotomy, which is actually a procedure where we basically destroy the pain nerves to those arthritic joints. How's blood pressure?
Good.
Now he is asleep for the procedure. He's under general anesthesia. He's under general anesthesia simply because our plan is to next do his Deuk laser disc repair procedure for his discs. He has problems with a couple of discs in his neck. He has herniated discs. All right, so let's take a look at what we've got. There's T17654, right? We're sitting over 4. You agree? And we need to go up to, what is it, 3? All right, we're going to go a little higher. Shot. Oh yeah, very nice. Any questions from our audience?
No current questions.
I feel the bone. Now, before you start your burning of the nerve, you really want to make sure you're in the right spot. Show us that spot right there, Jordan. It's a perfect spot. We're literally in the perfect spot right there. Yep. That's called a lateral mass. Show us the lateral mass. Shot. Show us the lateral mass. Yeah, so it's a big square there. So let me show you. Go to the right. Keep going there. Now up. Keep going. Up, 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 up. There. Now go over to the left along that line and then back down. That is the lateral mass. It looks like a giant. That's too low. Right where the black line is. There. Up, over, down. That's the lateral mass. And I am literally sitting in almost the perfect spot for that lateral mass for a rhizotomy. Now it could be a little more lateral, which I just did. Okay. I'm moving on to the next one. Shot. Okay. So the next lateral mass should be C4. We're going to work our way down. And I'm literally tapping on his bone of his lateral mass. And I'm literally just outside the lateral mass. Shot? That's it? Perfect. Yeah, it's perfect positioning. Doesn't get any better than that. This is a surgery that will replace rhizotomy, radiofrequency ablation, RFA rhizotomy. Currently, doctors that treat facet pain stick skinny little needles, right, Louis? Skinny little needles that don't do anything. And they don't work. And when they do work, it's just a matter of a few weeks or months before the pain comes back. So Deuk Spine Institute has developed a new technology where we go in and do a rhizotomy, but we actually deaden the pain nerve completely. And we do it permanently. Sean? All right, very good. We got a couple more to go, and we'll be done here. Now once we're done, we're gonna flip our patient over. We're gonna go through the front. We'll do his 2 herniated discs.
We have a couple questions.
Yes, I'll take the questions. Give me 1 second.
Copy that.
I'm just going to check position again. There we go. You see how the tip is moved now to the bottom of that arthritic joint? So I'm basically killing the pain nerves to the arthritic joint. And people ask me all the time, well, if you're killing the pain nerves, isn't that bad for the patient? No, it's not bad. It's good. This is an established treatment that's been around for a long time. The problem is that doctors have never done it the right way. Unfortunately, we've had non-surgeons doing this procedure, and non-surgeons, it's really a surgical procedure being done by non-surgeons. So now that we have a real surgeon doing it, it can be done properly, and I'm a neurosurgeon. So it's my job to operate on nerves. All right, we'll take the questions.
This first one comes from, excuse me if I'm pronouncing this name wrong, W on YouTube. And
Nice to meet you.
they asked, hello, I had
1 minute.
a discectomy L4 through L5 on October 30th of this year. I'm still having pain in my hips and having a hard time walking. What should I do?
All right, the first thing you should do is let your surgeon know so they can make sure you don't have a complication like an infection. They should get a new MRI to make sure you don't have an infection. Now, the second thing you should do is take that new MRI and send it to Deuk Spine Institute and let me look at it and figure out what's wrong. If you don't have an infection, you probably have residual herniation that wasn't treated, or you have a reherniation in the same place. So I need to look at your MRI. Shot? All right, that looks really good. T176. We're at 6 right now. Huh?
Yes, sir.
Yeah, I'm pretty happy with that. I think he should get some really good relief.
Sitting on, please. Thank you.
Great job, everybody. So, folks, we're done with our Deuk plasma rhizotomy. We can end the stream. We'll be back in about 15, 20 minutes with the Deuk laser disc repair, going through the front of the neck and fixing 2 herniated discs, C5-6 and C6-7, using a laser. Requires going through the front. All right, you can go ahead and end the broadcast.